Far northern coast of California.
Okay.
Thank you very much.
Close to the Oregon border.
Close to the Oregon border, near Arcata and Eureka.
So Del Norte County?
Beautiful.
Humboldt County.
Oh, Humboldt, that's right.
I'll tell you what, I'll just probably just...
pretty soon,
Okay.
so if we...
So I'm going to go ahead and
We'll just
start.
start you off and I'll just go downstairs and get
Yeah.
your husband's...
Okay. Yeah, I'm going to go ahead and start.
Okay, just go ahead. Introduce yourself.
I'll introduce myself. My name is Wendy Ring. I'm a family doctor. I've been in medical practice for about 30 years. And my specialty has been taking care of underserved people who don't have access to health care. And that's not an easy thing to do, and so every year I kind of check in with myself and say, is this what you should be doing? And for 30 years the answer was yes, go back and do more. And then last year I thought, no, I really have to do something about climate change. And what provoked me was reading some climate communication studies that showed that the best way to get people to understand about climate change is to talk to them about health effects. And my realization of the huge gap between what scientists are saying and what the general public and policymakers know about climate change. And I realized, after I thought about it a little bit, that health professionals have a very unique skill that we don't value that much, but it's really missing in this whole climate conversation, because we know how to translate science into regular English. Mm-hmm. And so we do it all day long. I mean, that's what we do, is we talk to people and tell them about the results of research studies and the standard of practice and all of that, but we do it in a way that they can understand and they can use that information for their own health. So that's what I have been doing. We're traveling by bicycle across the country. We've been going since the middle of July. I've given talks at medical schools, hospitals, Rotary clubs, house meetings, you name it. I've probably done it. And the response has been pretty good, except for one place in Gillette, Wyoming, which is the oil, coal, and methane capital of the United States, where even then they shook my hand and wished me well. I didn't get tarred and feathered. Climate, the way that climate affects our health is by affecting the things which are essential for health: air, water, food, and a safe environment. And we'll talk about air first, and we'll catch up with the slides as they show up. One of the things that we see with climate change is increase in ground level ozone. And ozone, when it's up high in the stratosphere, is blocking ultraviolet rays, and that's good, but down at ground level it's a respiratory irritant. And so when ozone levels are high, we see increased emergency room visits and hospitalizations for people who have asthma and chronic lung disease. The link with climate is that this ozone is formed when the products of combustion combine in the presence of heat and sunlight. So the more heat and the more sunlight you have, the more ozone you get. And there is an EPA standard for ozone, above which it's supposed to be bad and below which it's supposed to be good. But the truth is that sensitivity to ozone varies quite a bit, and particularly for young people or people who have lung disease, they're much more sensitive, and we see increases in mortality among adults and increases in asthma severity in children with every increment in ozone, even when it's below the EPA standard. So it's anticipated that we're going to see, as a result of this, by 2020, about 3 million additional cases of severe respiratory distress, and by 2050, 12 million cases of severe respiratory distress, just from increases in ozone that are related to climate change. Wildfire smoke is another effect that climate change has on the air. We've had about a 6-fold increase in wildfires and a 4-fold increase in wildfires that burn more than 1,000 acres. So what's in wildfire smoke that is particularly hazardous to health are very, very fine particulates that are easily inhaled into the lungs, and then they're so small that they can pass into the bloodstream. And when people are exposed to wildfire smoke, we again see the results of airway inflammation, and we see increased emergency room visits for people with asthma and COPD, but we also see increases in some cases in exacerbation of congestive heart failure, heart attacks, and strokes. When pregnant women breathe wildfire smoke, they give birth to babies that are lower birth weight. And this came out of some research that's been done in California, which is kind of the country's lab for the health effects of wildfire smoke. And of course that's significant because lower birth weights lead to higher rates of crib death and neonatal complications. The other thing that we're seeing in the Southwest is, and actually, so folks, I did a training yesterday at Public Health Department. I did two public health departments the day before yesterday, Grand Island and I can't think of the name, York. Yeah, and they were telling me that they are having health problems related to dust. But in the Southwest, because we're in a state of near perpetual drought there, and we don't have vegetation that's holding down the soil, we get wind erosion and big dust storms. Like the mile-high dust storms that come over Phoenix. And as a result of that, we've had about an 800% increase in cases of valley fever, which is a kind of pneumonia that people get from breathing fungal spores in soil. And the situation has gotten so bad that the California prison system is under federal receivership because they weren't providing adequate health care for the inmates. And this year, the federal receiver ordered that all of the inmates in the prisons in the southern part of California who were high risk for dissemination of that infection, not just the pneumonia, but having it spread to other organs. And this was about half the population, the prison population in those areas. Blacks, Filipinos, people over 50, diabetics, people with immune suppression, they all had to be relocated because they were having such high rates of morbidity and mortality from coccidioidomycosis, which is the big long name for valley fever. So we're also seeing effects that are related to, health effects that are related to climate's effects on water. And I'll try to group these in categories for you. First of all, we're having much more heavy rainfall. Only about 5% more rain overall, but coming down in much heavier storms. And of course, when that happens, the earth can't absorb it, and we get flooding. And also, when it's coming down more heavily, if someone's living in substandard housing, we get leaking, and that increases exposure to mold. So we know that if people have allergies and asthma, that this is, indoor air quality can affect them just as much as outdoor air quality. So again, we see those people more presenting to the hospital with exacerbations. We also know now that exposure to mold in infancy can cause asthma, and some research was done following a cohort of children from birth to the age of 7, and they went in at about age 8 months and took air samples from their homes. And the kids who had the highest levels of mold in those air samples as babies had the highest rate of hospitalization for asthma. It's mainly, what you're starting to see here is this pattern where the health effects are not falling evenly on the whole population. We're looking at something that has an element of environmental injustice to it. And there have been studies that have taken data and broken it down more, like the one I was telling you about the effects of wildfire smoke. And they were looking at emergency room visits for congestive heart failure and for asthma, and they found an increase in they were comparing fairly large groups of rural counties that were exposed to smoke in a fire in North Carolina, and they found that there was, of course, increase in those kinds of visits to the ER. Then what they did is they sorted those counties out by county health rankings. Are you all familiar with county health rankings? They use a number of different factors that are markers for health status, for access to care, socioeconomic status, to rank counties. And this is a national thing that's done, and all the counties in the country get ranked according to their health status. And so the counties that were in the lower group, the lowest group in terms of the county health rankings, had the biggest increase in emergency room visits, both for asthma and for decompensated congestive heart failure. And in the case of asthma, not only that, but unlike the group that was the group in the higher quartile, that effect persisted after the exposure to smoke was over. So we're looking at this hits unevenly. And the folks that we're seeing, and I'm going to talk to you more about who's in those risk groups, are like the canaries in the coal mine. The only difference being that we can't go up and breathe fresh air. There's no place that we can go if we make the climate unhealthy for humans. So pollen is another effect that we're seeing in air, and we've had pollen counts we think have probably doubled since pre-industrial times. And we know that from some experiments where ragweed was grown under different concentrations of CO2, and they started growing it under sort of pre-industrial levels of CO2, contemporary, and then what we expect to see in about 2075, and pretty dramatic increases in pollen production. And Ziska, that same researcher who does research on allergy and climate, has more recently predicted that our pollen counts are going to double again between now and 2040. So with all of these effects that we're seeing on the air, it's not surprising that the incidence of allergies and asthma in the United States have tripled since the 1960s. And we know that could be due to many different factors, and probably is due to a combination of factors. But one kind of smoking gun that we have that points to climate change is an analysis that was done by Quest, which is a large national commercial laboratory. And they looked back at 4 years of allergy tests. It's like 14 million test results. And what they found over that 4 years is that the percentage of positive tests for ragweed and for mold increased 12 to 15%, while the percentage of positive tests for other types of allergens like dust mites and animal dander either decreased or stayed the same. So moving back to talking about water and the effects of increased rainfall. One effect of increased rainfall and of climate change in general, and actually I really want to talk about this with air before we move into that, is that it mobilizes environmental contaminants. So we have a lot of things like mercury, PCBs, lead that have come to rest in the sediment or in the soil, and when you have wind erosion or water erosion, those things are remobilized, and we are at higher risk of exposure. Lead is, I think, for Omaha, a really important consideration. All of urban areas that have had experience of high traffic have a legacy of lead in the soil from our use of leaded gasoline. But when in combination to that, there have been in industries that result in lead contamination, like the Superfund site here that involved 15,000 households. That soil contains a fair amount of lead, even after remediation. And what we know now is that when the temperatures are hot and the soil is dry, that comes up as dust. And both the soil levels and the dust levels go up and down in a sinusoidal pattern related to the season. So you've got peak in the summer. See, I'm drawing you all these slides. You know? I don't know, I hope it's working. Peak in the summer, drop in the winter, peak in the summer, etc. And children's blood lead levels follow exactly the same pattern. So instead of, what health departments have been focused almost exclusively on with regards to lead, which is, children eating out of glazed pottery from Mexico or paint chips in old houses, what we're looking at here is chronic, continuous exposure, low-level exposure to lead, but high enough to result in lead levels that are, oh, here he is, in lead levels that cause permanent brain damage. And should we take let me pull this out. Can I get? Here it is. do we put this?
I'll put it.
Okay. I'll have to pick which one it is, but I'm just going to keep yakking while we're doing that, because we're doing so well, really, I think. You know, this is something that you can't go into a home and even at great expense and remove. This is going to be a persistent risk, and as we have longer, hotter, drier summers, there will be more exposure. Well, the only thing you could do is move all children out of the urban environment. So moving on to water, in terms of contaminants that are mobilized, what we see are increased exposure to PCBs and to mercury. And on our trip, we started on the coast of Washington, and we took a kind of a roundabout route because we were following the train tracks of the trains that are exporting coal from Montana to China, backwards. And we visited Spokane, Washington, and met with some environmentalists from there, and they told us about an experience they had where they were trying to find the source of PCBs that were coming into their river, and they went around to all the industries and ruled them out. It wasn't some kind of a point source thing, and it turned out that those PCBs were coming from storm runoff, and that is not an uncommon situation. So other effects that we're seeing with increased rainfall are increased exposure of people to human fecal matter, and this is because our sewage systems are not have not really been designed to accommodate that level of rain. And many systems in cities and towns, large and small, in the U.S., over 700 overall, are of a type called combined sewer overflow. And that means that the same pipes that carry away the raw sewage are also supposed to carry away the rainwater. That's what the combined part means. And what the overflow part means is that when there's too much going through those pipes for the treatment plant to handle, they are designed to dump that rainwater mixed with raw sewage into the nearest open body of water. And the best description that I've heard of the amount of raw sewage that we are now dumping every year because of heavy rains and combined sewer overflow systems is that it's enough to keep Niagara Falls running for 15 days.
On that point,
Yeah.
choose 45.
I will. Okay.
That's what we have. Do you know that Omaha is spending billions of dollars to correct that very problem?
No.
Yeah.
No.
We've been mandated or required by the government, is that right?
Yes.
Well, and it...
We're taking an approach that could be overwhelmed by increased rainfall. Instead of actually separating the sewers, they're trying to treat the overflow with a giant
tank, storage tank, yeah. I've heard of that. It is extremely expensive, not only to separate the storm water and the sewage systems, but it's also a huge expense to monitor all of those bodies of water for coliform counts and determine whether or not they're safe for people to use for recreation. And Pennsylvania has the highest number of those combined outflow pipes of anywhere in the country, and the Allegheny River is close to boating about 50% of the boating season because of high coliform counts. So we also have problems where the sewers just back up. And I have a great slide in here, maybe I can show you if you haven't seen this before, of rainwater going down the storm drain and then coming back up through the manhole like a fountain combined with raw sewage. So we're getting a lot of exposure. And it's not surprising as a result of that we see a pretty strong association between episodes of drinking water contamination in urban watersheds and heavy rainfall. So more than half the instances of drinking water contamination in those settings occurs after heavy rainfall. We also see increases in pediatric emergency room visits for diarrhea after heavy rainfall and a tripling of hospitalizations of children for gastroenteritis after heavy rainfall because they're more vulnerable, because they're at more risk of dehydration.
Could you, I have to leave in just a moment. Could you
Yeah.
say any way we could process our water so that it would be safer to drink?
You can boil it. But I think, you know, and I'm sorry that we started late and that you're not able to stay. You can find on YouTube a talk that I did, and it's a little different. You're getting the more technical version, but it's got the same ideas in it. But I mean, I think that the conclusion that I come to in the end is that this has to be treated like a public health problem. We cannot protect ourselves individually. We can only do it collectively by getting our government to address the root causes of climate change and decrease our CO2 emissions. There's really no way that we're going to be able to protect ourselves from the air, the water, contaminated food, mosquitoes, you know, it just not possible. Oh, do you got a clicker or anything for that?
I don't know.
No? Okay. Let me just forward us to where we want to be then. Okay. Well, we haven't talked about heat yet. We're going to be, let's finish water first and then maybe we'll go back. Okay. So, this is just a good slide about mortality and ground level ozone and what I was telling you about there's no safe limit. And you can see that the dose-response relationship is linear. People die every time the doses increase. And this is done in an asthma camp, looking at increases in ozone level, again below the EPA standards. And for every increment in ozone, you have an increase in the use of rescue inhalers. So I don't think I did talk about that. We know that ozone exposure chronically also causes asthma, and that kids who play outdoor sports in areas of high ozone have higher risk of developing asthma than kids who stay indoors. We're looking at increases in hospitalizations and emergency room visits on that basis. This is a prediction that was done for New York. This is what I was showing you about the experiment for growing ragweed, and also want to mention that we're also seeing that the pollen season is lasting longer, particularly the further north that you go, the more we're seeing lengthening of the pollen season, and we're seeing allergenic plants migrating into areas where they formerly did not live. We talked about mold. This is the rising incidence of allergies and asthma, pretty dramatic. This is the Quest analysis that I was talking about. Raisin Valley fever. Okay, and we didn't talk about erionite. Let's do that. That's important. So this is a concern that I have. I have not read anything about anyone else talking about this, but erionite is a fibrous mineral which is like asbestos, and it forms in areas where there has been volcanic activity in the past. And what we know about erionite is that it is very carcinogenic, and it causes mesothelioma, which is a rare type of cancer of the lining of the lungs, just as asbestos does. And this was first noted in this region of Turkey, where that erionite stone was soft enough to form caves, and people used to live in those caves, but now they are boutique hotels where for a lot of money you can go and spend the night in a cave. But the people in the villages built their homes from rock that was containing erionite, and 50% of the population died of mesothelioma in multiple generations. So they're called the Turkish cancer villages, and I believe they're working on bulldozing them now, burying them. So we have erionite in the United States, and we also have it in Washington, which is not on this map, but these are just locations, numbered locations showing where we know that we have erionite. And there is quite a bit of overlap with the areas where we are seeing epidemic levels of valley fever and dust storms. So there is a big concern in my mind that people are inhaling erionite fibers. And the time from exposure to development of mesothelioma is about 30 years. So unless we did some analyses of the dust clouds themselves, we wouldn't really know what kind of exposure people are having. There was some research done in North Dakota. A geology professor was at a conference and heard about the Turkish cancer villages and said, oh, we had that. And they had put it on roads, used as gravel on roads in North Dakota. And so he and a team went back in there and they measured levels of erionite fibers in North Dakota on the roadways, inside school buses, and inside homes that were every bit as high as those in the cancer villages in Turkey. Chest x-rays thus far haven't shown any of the changes characteristic of asbestosis, so we really don't know what the outcome will be. Yeah.
What's the numbers?
They're just like numbered from 1 to 45 or something. They don't signify anything. Connect the dot drawing, I don't know. And then there was another study done in a farming area in California, looking for erionite in the farm soil, which is the source sort of traditionally of the dust and the exposure to valley fever. And they didn't find it in the soil, but when they looked at air samples that were taken from just above the soil, they found erionite fibers in electron micrographs looking at those samples. So we really don't know the extent. And this is I'm just going to show you the pictures of what I was talking about. This is the summer-winter variations in blood lead levels in children. And that's the soil particulates and soil lead, and the consequences in terms of academic performance for children who have mildly elevated levels of lead. So you can see that the kids with the higher the blood level, the poorer their performance on standardized testing. And we've been through this part. And this is just a NASA. This is from a NASA satellite showing how far those small fine particulates and smoke can disseminate, and that has been the experience here in Nebraska. You all got smoked pretty well from the fires in Colorado, and this here is a fire in New Mexico that carried smoke all the way up to Denver, Colorado. So okay, we're back to water. I hope you're not feeling like you're being bounced all over the place. Okay. So another thing that we're seeing with flooding is just inundation of water treatment plants and flooding of sewage treatment facilities. And this is the combined sewer overflow and the people swimming in the Allegheny River. So there was some research done looking at what else might be coming out of those outflow pipes other than human sewage. And they caught fish that were near the collection of outflow pipes, and they caught fish in another portion of the river and kind of ground them up and made some kind of fish extract and put that on human breast cancer cells. And the breast cancer cells that got the fish extract from the sites that were near the outflow, the cells started multiplying like crazy because of the estrogenic effect that was in that water. And whether that was chemicals that had hormonal action or whether that was actual estrogen from people that were taking birth control pills in their urine, we really don't know, but it certainly is a concern. And that's the fountain effect that I was talking about. And you can have others, I can have a gallery of them from all over the country if you can get them from everywhere. And this is the relationship between rainfall and ER visits for gastroenteritis. So leptospirosis, I think we're caught up now. We're on water again. Leptospirosis is the most common zoonosis in the world, the most common disease that people catch from animals. And it begins with a flu-like illness, and when it's severe, progresses to hepatitis and then to acute kidney failure. It's treatable with antibiotics, but it's rare enough that it's often not recognized by physicians. And we've had about a doubling of cases of leptospirosis in the United States since the 1990s, and we've seen a similar pattern in dogs since around 2000. And veterinarians are now often recommending that dogs be vaccinated for leptospirosis. So the way that we get leptospirosis is if the urine of an infected animal, which could be a small wild mammal, it could be livestock, or rats in urban areas, or domestic pets, if that gets washed into a stream or a river or a pond during a period of heavy rainfall, and then those leptospires can survive for about 2 to 4 weeks without finding another host. And so if a human enters the water, they have a break in the skin or any contact with their mucous membranes, then they can get leptospirosis. So, and this is a pattern we used to see this as an occupational disease of people that handled livestock. And what's happening in developing countries, it's always been associated with rainfall, like this graph here. But we're seeing that same shift now happening in developed countries, where this is no longer just the result of occupational exposure. We're seeing this with recreational exposure. There have been outbreaks associated with triathlons and in whitewater paddlers. So between the dumping of sewage and the leptospirosis, we're definitely seeing an increase in the incidence of outbreaks of waterborne infections that are acquired during recreation. So another effect of climate on water is that the temperatures are warmer. And this is a remote sea surface temperature sensing program that is showing you Chesapeake Bay. And it's being used to try to predict when oysters are safe to harvest. Because Vibrio, which is a common marine bacteria, multiplies much more rapidly when the water is warm and concentrates in shellfish. So when the water temperature is warmer, and people eat that shellfish, then they can get Vibrio infection. So this is not only a hazard for people, but it also is extremely expensive and has caused lots of economic losses for parts of the country that engage in agriculture, like where I come from. So, and this is what we're seeing with the incidence of Vibrio. Fairly dramatic increase. Another consequence of cold water is an increase in harmful algae blooms. And the algae form toxins that affect the human nervous system. So again, what we see are people getting sick after eating shellfish. Paralytic shellfish poisoning begins about 30 minutes after consumption and can progress within 2 hours to complete paralysis and respiratory arrest. Amnesic shellfish poisoning is a little more rare, but it results in permanent loss of short-term memory. And in California, we've been seeing lots of immature sea mammals washing up on the beaches, and through some investigation and some research with exposing rodents to domoic acid, which is the toxin that causes amnesic shellfish poisoning, they found that when that domoic acid is consumed at levels that are low enough that they don't cause illness in a pregnant mother, they still pass through the placenta and cause brain damage and seizures in the offspring. Amoebic meningoencephalitis is another consequence of warm water. This is something that we've always had. It's fairly rare in small numbers in our southern states. But what's new is that we've had 2 children die after swimming in lakes in Minnesota from amoebic meningoencephalitis. This is a disease that affects children, usually healthy children, and there's only 1 child that's ever been known to survive. So very tragic. Recently, there was a case in the news of a child in Arkansas who died from this. But Minnesota, warm water, right? So what happens with this is the amoeba are temperature sensitive, and when the water's cold, they're in an inactive form, and when the water warms up, they move into a reproductive phase. And if a child is swimming and they put their head underwater, then the amoeba enters through the nose, follows the olfactory nerve up to the brain, and starts consuming the brain. So in freshwater, we're also seeing increase in harmful algae blooms, and this has been a problem in Nebraska Lake McConaughey was closed, I think, for quite a while, and there's several lakes, additional lakes that were just recently closed because of blue-green algae blooms. And blue-green algae produces a toxin called microcystin, which is dangerous to the liver. It can also cause dermatitis and some gastroenteritis, but its main effect is hepatotoxicity. And with acute exposure, someone drinks it, they can get hepatitis, and with chronic low-level exposure, it increases the risk of liver cancer. So there has been sampling done in lakes all across the country in the summertime, and whether they have visible algae or not, about a third of the lakes in the Midwest on sampling have shown levels of microcystin that are hazardous to people and animals. And the level of microcystin close to the shoreline, where children or dogs would be playing, can be about 1,000 times higher because the algae tends to crust up there than the level of microcystin in the middle of a lake. So usually our standard water treatments can remove microcystins, but the problem that we are having with water treatment is that when these blue-green algae die and decompose, that puts dissolved organic carbon into the water. And when chlorine, which is commonly used as one of the steps in water disinfection, combined with that dissolved organic carbon, it forms a disinfection byproduct which is carcinogenic and more difficult to remove. So for small water systems, this can be a huge expense, and I'm not sure that it's really always being done. So in terms of increased air temperature and its effect on food, what we're seeing in the U.S. is an increase in corn crops that are contaminated with aflatoxin. And aflatoxin is a product of a mold called aspergillus that affects corn when it's grown under drought conditions. And we're seeing quite a bit increase in the amount of corn that has aflatoxin in it. And this is one of the most powerful natural carcinogens that is known, and it causes liver cancer by going into the liver and binding to the DNA and turning off a tumor suppressor gene. So these are the areas of the country where we've been having corn crops with levels of aflatoxin which are higher than the Food and Drug Administration limits for human consumption, or for feeding to dairy cows because the aflatoxin will come out in the milk, or for feeding to food animals. And what the FDA has done for 2011 and 2012 is they gave permission in 4 states where this was a significant problem for the farmers, instead of destroying that contaminated corn, to be able to sell that corn as long as they blended it with corn that did not have aflatoxin in it and brought those levels down below the standard, which would have the effect of increasing our exposure to aflatoxin by, who knows, double, triple, quadruple, who knows. So this has traditionally been more of a problem, the liver cancer from aflatoxin, in Asia and in Africa, because aflatoxin alone will triple the risk of developing liver cancer, but aflatoxin in combination with conditions which cause chronic inflammation in the liver can increase that risk 60 to over 100 times. And so in Africa and in Asia, liver cancer is much more common than it is in the United States. These studies were done in Asia, where the most common cause of inflammation is chronic hepatitis B. But in the U.S., we have chronic hepatitis C, and worse than that, we have an epidemic of non-alcoholic fatty liver disease. And we are starting to see hepatocellular carcinoma in patients who have non-alcoholic fatty liver disease, even without cirrhosis, which used to be thought to be a necessary precondition before someone would be at increased risk of cancer. So, and this is not distributed equally among the population. Latinos and Native Americans have higher rates of fatty liver disease, and but overall, somewhere between 30 and 46% of the U.S. adult population has fatty liver disease by ultrasound criteria. So if you throw some aflatoxin on top of that, that's like throwing kerosene on a fire.
Could this affect dogs as well?
It could, and there was an incident where aflatoxin contaminated corn got into dog food in the U.S. and it had to be recalled, but some dogs did get sick, and I don't know if any died. I don't remember the details.
Because I just took my dog to the vet, and because of a lump on the side, he says, "Oh, that feels like a fatty tumor."
Oh, that's different. That's different.
Oh, okay.
Those are the things that my husband Michael calls old dog lumps, and they're like lipomas, and they're harmless. This is fat that's in the tissue of the liver, and as you can see, liver cancer is not distributed equally among the population either. The rate among Asians is higher because that's reflecting a lot of immigrants coming in with chronic hepatitis B. But after that, you see Native Americans and Latinos are much higher than non-Latino whites. So there hasn't been a lot of looking at aflatoxin in exposure in the United States because the earlier studies that were done showed that exposure was low. But there was some research done in southern Texas where the rate of liver cancer is about 3 times average, and they went and looked for serum and urine biomarkers of aflatoxin, and they found that about 20% of the population that were just randomly screened had elevated, had detectable aflatoxin biomarkers, and the quantity was related to their dietary patterns, and those who consume more tortillas and rice, i.e. a traditional Mexican diet, had higher rates than, and higher rates of positive and higher levels than folks who were following a traditional American diet. So, FDA is setting these levels, assuming that everyone eats the same diet, and some subpopulations are eating a lot more corn than others.
So basically you're saying that the liver and the bile duct cancer is because of corn?
I'm not. No. Probably most of what we're seeing now is because of fatty liver.
And that's through how?
Fatty liver is associated with obesity and with the metabolic syndrome. So probably that's most of what we're seeing, but we may be seeing aflatoxin helping it along. And aflatoxin liver cancer is the fastest growing cause of cancer death in the United States. Also probably being driven some by hepatitis C. So it's a mixed picture, but you wouldn't want to take that background and put aflatoxin on top of it. Other effects on water that we're seeing related to drought. When here, I gotta get my throat in shape here. When we don't have rain and we can't recharge our aquifers, we're pumping for domestic use and for irrigation. We're depleting the aquifers, and that has some consequences for water quality. Goodbye. Thank you. And one thing that we're seeing is an increase in arsenic levels. Arsenic is a naturally found mineral in many parts of the country, and it's often, though, in an inactive form. And so it's covered with water in the aquifer. But if there's enough pumping done without recharge from rain, and the water table drops, then that arsenic is exposed and it's oxidized, and it becomes arsenite, which is not only much more soluble and mobile to move into the water, but it's 10 times more toxic than arsenic. So, we all know from mystery stories about people getting murdered with arsenic, but chronic low-level exposure causes cancer. This is another situation where there really is no safe level. The cutoffs that we have are based on what we think is the number of people that we think it's acceptable to get cancer. And so this is This is a problem that we'll see more of as we have more and more depletion of groundwater. We also are seeing increases in levels of nitrate, and what happens with the nitrate is a different story. You know, farmers fertilize for the crop that they hope to have, and in times of drought, if those plants don't grow well, then they're not taking up that nitrogen, and that leaves that nitrogen sitting in the soil, and with the next rain, when the rains return, that nitrogen is added down into the groundwater. So nitrate contamination of groundwater is even at levels that are 1/2 of the EPA standard, double the risk of thyroid cancer and hypothyroidism. And that was a study that was done in Iowa on farm women who were exposed from well water. We also see increases in birth defects, particularly anencephaly, and in babies under the age of 6 months, a condition called blue baby syndrome or methemoglobinemia, where the nitrate is converted to nitrite and it binds to the hemoglobin and decreases its ability to carry oxygen. So we're also seeing increases in diseases that are carried by insects that are somewhat related to climate change. This is sort of the story of West Nile virus. It first started in New York in 1999, and within 5 years has spread across the country. Researchers looked at 13,000 cases of documented West Nile virus and compared them against weather reports of when those infections were contracted, and found that there was a very clear relationship between rainfall and temperature. And the rainfall is kind of obvious. That leaves standing water for mosquitoes to breed, and humidity makes mosquitoes bite more. But the temperature effect has to do with the fact that when you have a longer period of warm weather, that you have a longer season for the mosquitoes to breed. They also grow more rapidly to maturity, and if they're carrying viruses, the viruses multiply more rapidly as well. In the southern part of the country, we've also seen a resurgence of dengue fever, and since the 70s, we've had 7 outbreaks in southern Texas, 1 in Hawaii, and 3 in South Florida. And after the first South Florida outbreak, which was in Key West, the Florida Health Department did some random serology testing of the population of Key West, and they found that about 5% of the population showed evidence of recent dengue infection, which was way more, of course, than the reported cases. The significance of this is that if you catch dengue one time, you get dengue fever, which is just a high fever and pains in the extremities. But if you get a second infection with dengue fever of a different strain, then it activates the immune system, but instead of the immune system being able to focus and destroy the virus, it affects the victim's body and causes a coagulopathy. They're not able to clot blood, and they start having bleeding and bruising, and that can progress to dengue shock syndrome, where the blood vessels become leaky and there are collections of fluid in the chest and abdominal cavities. So another thing of interest that I learned when I was at Grand Island is that they had a little outbreak of dengue there that was not from here. It was brought back by a team that went to do some service work in Haiti. But what they found was that people who had previous history or serologic evidence of West Nile virus infection have more severe illness. Out of the 5 that had that, 4 of them were hospitalized, and several of them had to receive transfusions. So the CDC came in on that, and there was some thought that there's enough cross-reactivity that you could end up having hemorrhagic fever if you had had a prior West Nile virus. And this is just showing you the return of dengue to the Americas. And a model of for forecasting dengue on the basis of rainfall and temperature, which is over 95% sensitive and specific. Chagas disease is sometimes called the AIDS of the Americas because the initial infection is usually asymptomatic or sort of vague flu-like symptoms, but ultimately about 30% of the people who are infected with the Chagas parasite will end up with congestive heart failure or gastrointestinal dilation. And the Chagas disease is transmitted by a trypanosome bug that is sometimes called the kissing bug because it likes to bite on the face, and other times it's called the assassin bug for obvious reasons. And we have those insects in the United States, in the southern half of the United States, and we also have the parasite. So it's been a little bit of a question as to why we don't see people getting Chagas disease in North America. Most of the people who have it in our country, about 300,000 people, were infected in Latin America and brought it and came in as immigrants. And one of the theories was that it's because we have better housing and because this bug likes to bite at night that it isn't able to get in and bite us. But some researchers did a survey of trypanosome bugs that they found around homes in California and Arizona, and they found that about 50% of them were infected with the parasite, and 40% of them had recently fed on humans. So they are biting us, and this can be transmitted not only from bites of the trypanosome, but also by consuming food or water that's contaminated with its species. It can be transmitted vertically from a pregnant mother to an infant, and it can be transmitted by blood transfusion. So we have been monitoring our blood supply for some years now to screen out Chagas, and we're starting to find cases of Chagas in people who never travel outside the U.S. So if I have to sum this all up, in one slide, this would be it. Health is not something that we can assure ourselves by individual behavior. We depend on clean air, clean water, safe food, and a safe environment for our health. And if climate is affecting all of those things, there's no way that we would be unaffected. So the group that I belong to is called Climate 911. We think this is a public health emergency. And if we do not do something significant very soon, we're going to have temperature increases of somewhere between 7 and 12 degrees by the end of the century. So why am I here talking to you about this? Because, as I said before, climate communication research shows that talking about health effects is the way to get people to care about climate disease, and we are the people that they trust to tell them. The other reason is because the things that we're doing that are causing this climate change are also in and of themselves causes of ill health. And I like to put these two pie charts up next to each other. One is the sources of greenhouse gas emissions in the United States, and the other is the top 10 causes of death in America. And the reason that they look so much the same is because they are related. For one, we are spending more and more time in cars and less time moving around under our own steam. This is pretty dramatic change here, even this is recent times. And compared to other countries, the level of physical activity in the United States is just dismal. So what are we seeing as a consequence of that? We are having epidemics of heart disease, obesity, diabetes, and several common cancers. So about a third of those people would not be sick if they had gotten 30 minutes of exercise 5 days a week. So what could we do about that? We could get people out of their cars. Increased fuel economy doesn't really help because it's competing with increased number of cars and increased number of hours in the car, so they just cancel each other out. We really have to get people out of the car, moving under their own steam. And to do that, we have to have some changes in funding for housing and zoning that will promote mixed-use development. We have to have increase in biking and walking infrastructure. We now spend 1% of federal transportation dollars on bike ped infrastructure.
And in urban areas, we need to have effective public transit, which is also a form of active transportation because people have to walk to and from. And people that use public transit have higher percentages who get the recommended amount of daily exercise. If we were able to do that, this is the immediate gains that we would see just from increasing the level of physical activity, and this is every year. And some projections were done by Neil Maislish of the California Department of Health of what kind of savings would accrue from that, from active transportation, just in the San Francisco Bay Area, and it is billions of dollars a year. So he used the same methodology that came from this study, showing how much money would be saved and on what by the National Health Service in Britain if they had active transportation increased in London. So we also need to improve our energy efficiency. We're using about half our energy to heat and cool buildings, and about half of that is wasted. Our vehicles are not anywhere near as efficient as the technology could make them be. And we really have to make the turn towards clean energy now. There has to be a cessation of exports of fossil fuels because if they're burned anywhere, we get the same climate effect. And we need to take our capital and invest in clean energy and not in new fossil fuel burning plants. And we need to do something with our cost accounting so that the social cost of burning fossil fuels is included, so that when we're comparing the wind and solar with burning coal, for example, that we have all the costs of coal. And not, some of them now we're paying in our health insurance premiums, we're paying them in our taxes for infrastructure repairs and disasters, and it needs to all be included in the cost. So if we did that, we would have a very rapid improvement in air quality. And we know that because of the Olympics in Atlanta and in Beijing, when they excluded cars from the central city during the Olympics, they saw an immediate decrease in emergency room use for respiratory conditions. It's that fast. Save over $100 billion a year. And finally, we really need to make sure that our farm policy is consistent with our nutritional policy. If we are paying farmers to grow feed for cows, and then we're telling people to eat less meat and more vegetables, we're not really creating the conditions for them to do that. So we eat about twice as much red meat as is recommended, and less than a quarter of us get the recommended number of servings of fruits and vegetables. If we were able to have consistent farm policy and incentives for good stewardship as well, this is the health benefits that we could see. These numbers are huge. These are big numbers here every year. So this is a very busy slide, but it looks at, for if anyone in here is a skeptic, these are two ways of looking at this. One is taking people who already have metabolic syndrome, insulin resistance, or cardiovascular disease and putting them on a Mediterranean diet. And you can see there the incidence of morbidity go down compared with people who are left on their regular diet. And the other is prospective, where you're comparing what happens to different groups of people who are on different diets. But the differences are there either way. So why can't we just keep lecturing people and telling them what to do? Because it doesn't work. I can tell you from 30 years in medical practice it doesn't work, but we know that from data too now. We know that there is no lasting effect from diet or exercise advice. The only thing that doctors can tell patients that seems to make any difference is quit smoking. Other than that, it's really ineffective. And it's not working. This is a website that you can go to, which is tracking where we're headed in terms of temperature increase. And it looks at what happens if we continue business as usual, which is the yellow line. If all of the promises made by all the countries to decrease emissions were kept, which is the blue line, and the green line were passed already, so don't even look at that one. And you can see that in 2010, the initiatives of governments around the world would have made a pretty significant difference, but now not anymore. And we're looking at a higher temperature now than we were several years ago. What does work? Well, we know. Changing the environment, having policy that changes the food environment, that changes the physical environment, is the way that we change behavior. So we know that if we put a supermarket in a low-income neighborhood, we can increase family consumption of vegetables by 30%. We know that people who live in walkable neighborhoods have lower rates of diabetes and hypertension, and they weigh an average of 10 pounds less. We know that people who live near freeways